Now we come to the number 15. So chronic constipation can also be caused because of colorectal issues. And one of the ways to identify that is to check whether there is blood in our stool or not. And in order to verify that, we can conduct home stool blood test in order to check for hidden blood in the stool. And if there is blood in the stool, it can indicate more severe digestive problems. And obviously, we can do in two ways. Number one is the visual way. And when after our bowel movement, we can observe our bowel movement and check whether there are blood in our stool. For example, the blood could be in different colors: bright red, dark red, brown, and even darker. So each of these colors can indicate the origin of the blood. For example, black can indicate its origin is stomach, or brown can is small intestine, and as you go lower and lower, it can the brightness of red decreases. And if it is bright red, it can be hemorrhoids or fissure. So that visual inspection can tell whether we have other digestive issues that's causing chronic constipation. So another way is obviously there are invisible blood markers, and that can be tested using at-home test that can indicate whether we have other colorectal issues. And some of the over-the-counter blood test kits are the following. Number one is Easy Detect Stool Blood Test. Number two is Hemo Occult Sensa. Number three is Coloscreen. Number four is Immunochemical Fecal Occult Blood Test. And Easy Detect Stool Blood Test and Hemo Occult Sensa is over the counter. You can do it at home. A coloscreen and immunochemical fecal blood tests that needs to be sent to the laboratory, but that still can be done at home at as a much lower cost than other invasive procedures. These are non-invasive ones. When we do these tests, visual inspections or over the counter or laboratory, we can, if you find trace of blood, then that needs to be confirmed by other more invasive or other laboratory test. But again, at home test can give us more indication that whether we have other form of colorectal issues or digestive issues. Best case scenario is that we don't have blood. In my case, it was bright red, so it was because of hemorrhoids and fissures. And when they did colonoscopy, they couldn't find anything as well. There is no bleeding or in my rectum, or there is no bleeding in my large intestines, and and so on. So it was fairly, in the scheme of things, less concerning. But again, blood in stool is always concerning. But this home test can help us detect whether there is visible or invisible blood. And when we find any trace of blood, the wisest decision we can make is contact the healthcare provider and further diagnosis so that we can get a treatment as soon as possible, because our chronic constipation is merely the symptom of more severe diseases.